Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada, and my co-host today is Kim Stovall, Behavioral Health Navigator at Roots Community Health Center, and we are reporting for the week of September 26, 2020. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you the information you can use to make the choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking in 15 minutes every Tuesday morning of every week. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though this pandemic is worldwide, the effects are very different depending on where you are. So we are here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. We now have over 21,000 coronavirus cases in the county of Alameda. The city of Oakland, which is only 25% of the county's population, has about 40% of the county's COVID cases. There are over 400 deaths from COVID in Alameda County, with 56% being among men and 44% among women. Last week, the state moved Alameda County from the purple tier into the red tier, meaning that some of the restrictions that are currently in place can be relaxed. These tiers are part of the state's new monitoring paradigm. Criteria for the purple tier, meaning widespread, includes a positivity rate of 8% or higher. Alameda County has a positivity rate of about 5%. However, when we look at the East Oakland zip codes, we see that the 94603, the 94621, and 94601 have positivity rates between 14 and 16%. So clearly, if East Oakland were its own county, we would not be reopening anything. The red tier, which is where Alameda County currently sits, still indicates substantial risk. Here's the list of Alameda County openings, which was updated this past Friday. The only change being put forward at this time by Alameda County Public Health Department is that nail shops are now being allowed to reopen for indoor services. One of the things that we are most concerned about right now is that when more businesses begin to reopen, cases will start to increase again. So my message to you today is that just because something is open does not make it safe. Please do your own research, do your own reading, and use your own critical thinking skills. Nail salons are unfortunately concerning because some services take a long period of time and some of the shops are small with poor ventilation. And having several people in a small space and breathing the same air over a period of time is worrisome. Actually, it's the opposite of what we need to be doing right now. Being outside is the best, limiting time indoors with people other than your household members is still the best, and if you must be indoors with others outside of your household, they should all be wearing masks. Businesses are required to provide their employees with masks and to refuse service to those who won't wear one. So to review again, just because something is open does not mean it's safe. Being outdoors is best. Limit the length of time that you spend indoors. Avoid crowded areas. Mask up and space out. Now, we know that everyone wants to get outside and get back to doing the things we used to do, and that is understandable. And we have to weigh the risks of doing these things against the risk that not doing them can lead to further isolation and behavioral health symptoms. A recent report published in the August 14th issue of the Morbidity and Mortality Weekly Report indicates that certain groups are disproportionately affected by COVID-19 related stress. These include young adults age 18 to 24, Black and Latino, essential workers, unpaid caregivers for adults, and those receiving treatment for pre-existing psychiatric conditions. These groups were shown to be at higher risk of starting or increasing substance use, thoughts of self-harm, and behavioral health symptoms. Now, not all of these groups are the ones we are used to seeing as being at risk, but these are unusual times and we want you to be on alert. Our young people, 18 to 24 years of age, are experiencing unusually high stress levels. Our essential workers are under tremendous pressure to stay safe, being on high alert for their entire shift and then returning home worrying about bringing the virus to their loved ones. Our caregivers, and this could be parents caring for their children or maybe an adult caring for an elder parent, are also under a tremendous amount of pressure. We also worry about abuse and neglect of vulnerable people, children, seniors, those with disabilities, and so on. We have to remember that with schools and day centers being closed or limited, abuse and neglect may be underreported at this time. which is why it is so important that we check in on anyone we may be concerned about, including caregivers. And now my co-host, Kim Stovall, will go into more detail about COVID-19 stress.
Hi, my name is Kim Stovall, Behavioral Health Navigator at Roots Community Health Center. So each week we will address some widespread misinformation about COVID. In my role at Roots, I've seen some of the things that impacted the people that shelter in place with moderate to severe health conditions. So I want to share with you the things that I've seen and what I know. After the shelter in place order took place, we saw people with high stress levels. We've seen some people relapse from substance use, and also people stop taking medication that was needed. I have observed relationships under stress right now with elderly seniors and children. With school being out right now, there's a high level of stress that's been unreported. Some of the things that we know that can help in hard times, we also have where we can FaceTime each other. We also can Zoom. Sometimes we can just meet in a park if that's what you want to do. We also have the parking lot that's available to you. We can social distance ourselves and just let it all out. I just want you to know that I'm here for you. We still have clinicians and counselors here that's available for you. I just don't ever want you to feel like you're alone. So if there's any information that you want to report on, you want us to know whether it's facts or fiction, submit your request on Facebook, direct message us, or send an email to admin@rootsclinic.org. The only way that COVID-19 won't affect you is if you're protecting yourself and others around you. Meaning, if you have to attend a gathering, if you have to attend a funeral service, wherever it is, you have to protect yourself at any cost. I would just like to say to use your own judgment, and also don't lose sight of what got us here. Just keep in mind of how this virus has spread, and don't lose sight of why we started the shelter in place. A myth doesn't kill people. Viruses kills people. So protect yourself at any cost. Please wear a mask at all times, indoor and out. Now back to Dr. Noha with her final words.
Thank you for that, Kim. So here's our best advice one more time. Things are starting to reopen. This does not mean throw logic out the window. Ignorance is not bliss. Please do your own investigation, inform yourself, and protect yourself. Don't let one tragedy, like the death of a loved one, turn into more tragedies. In-person funerals should not be happening, as we know it is very hard to be grieving with loved ones and avoid comforting one another. And we have seen funerals and other gatherings turn into major tragedies due to a COVID outbreak. Just because something is open does not mean it's safe. Just because something is allowed does not mean it's safe. Being outdoors is best. Take a look at the COVID rates in your area and act accordingly. Limit the length of time you spend indoors. Avoid crowded areas, mask up, and space out. That concludes today's health briefing. Please submit your questions in the comments, direct message us, or send us an email at admin@rootsclinic.org. Please tune in next Tuesday at 10 a.m. and thank you for watching.